Good morning, everyone. I must apologize for not being able to deliver this presentation in person. I had a family commitment that came up in the middle of the night. I will, though, be giving you a lecture on POCUS, which is point of care ultrasound, and I hope you guys enjoy it. And I hope you guys enjoy the rest of the day with regards to your World Day of Regional Anesthesia. It won't be a long presentation. We will be focusing on the introduction to POCUS, some of the primary goals of POCUS, some of the POCUS teaching models that have been used, a recommended textbook, especially if you want to practice POCUS, and the current updates with regards to POCUS. Point of care ultrasound refers to the practice of a trained medical professional using ultrasound to diagnose problems wherever a patient is being treated, be it a modern hospital, an ambulance, or a remote village. Point of care ultrasound is a broader term that encapsulates many scenarios which a portable ultrasound machine can be used. The primary goals of point of care ultrasound are to aid clinical evaluation and diagnosis of our patients, to have goal-directed treatments, to answer specific questions in a yes or no manner with the protocols that are provided by each system. The models that have been studied for POCUS. So it's called the I-AIM model. So I stands for indication. So you look at the patient's history and examination and relevant investigations, for instance, your ABGs and your ECG. And then you look at your acquisition. So acquisition, you need to look at the patient's position, probe selection and orientation, and then the appropriately selected protocol for this patient. And then the I is for interpretation. So you interpret according to the protocol that is being provided. And then your M is for your medical decision making. This is just a continuity from the previous I-AIM model. So again, it looks at the interpretation. So you interpret according to the protocol that's being provided. At this instance, we are looking at the blue protocol, which is basically your basic lung ultrasound in emergency settings protocol. And then in terms of your medical decision, you have to decide if you either intubate the patient, are you putting up an intercostal drain or not, and what type of diagnosis are you actually giving this patient. This is an image of one of the protocols that are used in POCUS, which is your focused assessment thoracic echocardiography. We won't be dwelling much with regards to this protocol, although we'll be looking at two important views, which is your parasternal long axis view and your parasternal short axis view. These are the two important views for your focused assessment thoracic echocardiography, which is your parasternal long axis view and parasternal short axis view. With the parasternal long axis view, you basically place your transducer probe on the third to fourth intercostal space on the patient's left side, making sure that the probe marker is facing towards the right. You'll then get to appreciate structures which include the right ventricle, left atrium, and your aortic outlet. On the same level, on the third to fourth intercostal space, you then rotate your probe 90 degrees, which will then give you a parasternal short axis view. These two views will allow you to actually assess the patients for any pericardial effusion and for also any pleural effusion, using these two important views. This is one of the recommended textbooks that are used, especially if you want to study POCUS, as it covers majority of the POCUS protocols. This is one of the articles that has been written on point of care ultrasound, the new district focus, which is an article that was taken or that was written in the Western Cape, in the western region of the Western Cape. It basically explores that POCUS actually has a lot of advantage when it comes to it being used by the fact that it's portable, it's non-invasive, you can reproduce whatever that you've actually scanned, there's no ionizing radiation, it's less expensive, it's more reliable than some of the other imaging modalities, especially if we are relying on chest x-rays with regards to diagnosing pleural effusions. And it's ideal for resource-limited areas. Part of the conclusions that came from this amazing article was that focus is informed by your local pattern of disease, and there's a lot of need when it comes to implementing of the training programs, especially for your medical practitioners, your family medicine registrars, and also your family physicians. This is another article that looked at point of care and lung ultrasound incorporated in daily practice. It found that one of the advantages is that it can be easily taught, it's non-invasive, it allows for real-time clinical information of these patients, it aids in the diagnosis of life-threatening pathologies, and again, it aids in optimizing our patients' care. This is a third article that looked at POCUS as part of the medical training. Is this the part of the issues that was found was that there was lack of expertise when it came to training. The solution to this was to actually train people at grassroots level, especially in medical school. A second point that was extrapolated from this article was that there was lack of training opportunities, which was identified in the anesthesia community. This article is basically written by people that are involved in the perioperative and anesthesia care, which are part of our own society. The solution to this was actually incorporate the teaching as part of your postgrad training. And then the third solution was POCUS is now being done in high fidelity simulators, and especially in the third and the fourth year of students' training curriculum. This is something to think about. It's on artificial intelligence and POCUS. So currently, we've found that artificial intelligence will actually help with POCUS by taking it to the next level by providing with the immediate and most accurate diagnosis of patients. So the image that you're looking at below was just a 5-chamber view looking at the left ventricular outflow tract, and the machine automatically calculated everything just from just looking at that image. So indeed, AI is coming into play when it comes to POCUS, and it's going to take us to a far more better game. My take home message to everyone is that POCUS is a growing skill that all physicians must have. There is a need for POCUS in resource limited settings, especially in the rural settings. POCUS does have limitations, especially because there isn't a lot of certifications and teaching programs. Teaching POCUS to medical professionals and medical students is very crucial, as we can all see that we are heading towards a more POCUS-based assessment for our patients. Artificial intelligence and POCUS is the new kid on the block, and it's going to aid us in terms of managing patients.